Hi, we're just doing some strong soft tissue here today on a lumbar erector spinae muscles. The patient in question has got a little strain to the annulus of her disc, which is causing some secondary muscle spasm in the area of her lumbar spine. And what you can see that we're working on here is a sort of good cross-strong fibre technique, whereby we're just getting into the gutter of the muscle and then literally applying a downward pressure and then backing that up, just reinforcing that. And as we're going along, we're sort of trying to feel if there's any kind of sort of hypertonic areas which are sort of quite chronic in nature, quite fatigued musculature. They can be known as sort of muscular knots, and they tend to respond very, very well to some deep sort of dry needling. And what I can feel just in this little corner here adjacent to our L4 transverse process, that there's just a slight little bit of thickening here. So I'm going to apply the needle through the guide tube, and then slowly we're just going to have a little push through so we can get it down deep into that muscle. And what you'll notice here is it's slightly different from the sort of traditional Chinese acupuncture. It's actually quite deep needling, and I'll go all the way down into the gutter, sort of almost up against the lamina, so you can't go no further. So we're getting a real deep intrinsic change to the tissue. This should sort of definitely increase the amount of blood flow in and around the tissue and downgrade the tightness of that muscle. And because it is so deep, it's just that little bit more, I don't know, it works that much better on the patient's tissues, because your thumb, fingers, etc. are going to get down so far, but the actual depth of the real intrinsic muscles work best if they're done with an actual needle itself. And I think a lot of therapists tend to go wrong. They tend to just do a very superficial needle, i.e. like so, and the actual trigger point or the actual knot itself might be 1 or 2, possibly 3 inches down. So that's why it's always best to go all the way until you can feel that you're onto the bone itself, and that way. So this one here, you can feel the patient's wincing a little bit, and we would leave that for around about 2 to 3 minutes, or until the actual needle has defacilitated the area. The patient is sort of almost like a little twitch sign. You get as soon as the muscle hits that sort of fibrousy area, they'll almost get that little sort of spasm within the muscle, and that's the muscle gripping the needle, and then over time it will generally just relax out. If you don't get the twitch, then you're not really on the money. You've got to move the needles around until you get that sort of initial response. And like I say, it works very, very well. And then what we would tend to do is, after doing these needles, is just then go back in with a reinforced thumb, because again, some patients or some therapists tend to just needle on its own, and then they take the needles out, let the patient go away. We're actually quite on it in a sense that we like to actually soft tissue as well, post sort of needling, just to sort of create a little bit more stretch, a bit more harmony really within the tissues. And rather than sort of just leave them and walk away and read a paper and take some calls, which I know a lot of other therapists can do, I find it's a little bit lazy. It's good to keep probing the area. There you go, you can still see there's a little reaction there to that one. So I'd leave that one in until it's done its job. So I'm just going to remove that one now. Good, and as you can see there's no blood or anything out. So again, we're just going to have a little test of the tissue, just re-evaluate, is that little fibrosy knot still present? And again, coming in with a thumb and a nice little reinforcement just there, nice downward pressure, and we're looking to hold this for around about 7 seconds. Again, you don't want to sort of irritate the muscles further by doing lots and lots of fast soft tissue, so it's just very, very gentle, holding for 7 seconds just to relax those muscle spindles off. I'd just like to just briefly show you a couple of pictures of the back muscles, because what some people might not appreciate when we're doing the deep dry needling is that, albeit yes, when the needle goes in, it's generally into the muscle belly, and you'll see by this picture that you've got the superficial muscles just under the skin, such as the large ones, the trapezius, latissimus dorsi, etc. But again, when you go to the next level down, if you was to remove the superficial muscles, you have a deeper layer of muscles, i.e. longissimus pharesis, iliocostalis, lumborum, etc. Now it could be the superficial layer that has the problem with the trigger point or the sort of fibrosy knots, or it may be this layer. And then you can then take that layer off, and then you come down to the real deep muscles, which are sort of attached to the spine itself. So you can almost see that by having this kind of needling, it's very important in order to actually get down to the right level of muscle. And if I come through just one more layer, so there's 4 layers of muscle that we've gone off there. And again, you can see these are where they are actually attached to the actual spine itself and the rib cage. So you need to go down a good sort of 2 to 3, maybe even 4 inches in places in order to get down to these real deep muscles, which could be the main cause of a patient's pain rather than the superficial layers which lay upon.